If a patient pulse cannot be assessed, the blood pressure is absent or not recordable, and then there's no respiratory effort, and the patient's body is cold and clammy, it doesn't necessarily mean that the patient is dead. That so many persons have been certified dead while they are alive and either been sent to the mortuary or being buried in an environment simply because the person that assessed them as at that time the event played out could not assess their pulse, could not measure the blood pressure, or probably there was no respiratory effort. And to this end, assume that these persons are dead. But who are these category of people that do this? Probably people at the time when the event played out, some quacks maybe that first saw the patient when patient got to them at one point or the other. People in white coats that do not have the proficiency to be able to assess a patient, to know if the patient is in shock or dead. At some point, it's possible that the patient is just in shock, deeply comatose, and cannot initiate the responses or initiate those reflexes to be seen. How do you assess a patient to be clinically dead? Now, this in a normal setting should be done by at least 2 or more trained consultants to be able to say, oh, this patient is clinically dead. And what are the things that will be assessed? In addition to the blood pressure, the pulse, the respiratory effort or rate that needs to be checked on this patient, the patient's brainstem reflexes need to be ascertained. And it is only these brainstem reflexes, when they are absent, that we can say that the patient is clinically dead. Anything outside this and the patient is satisfied dead, please, it is wrong and should not be practiced.